We're following up on a story we first brought to you on Tuesday about a homeless woman who is pregnant and struggling with addiction who went into labor in her tent. Tonight, Blair Best takes a look at the impact of our fentanyl crisis on newborns and how cases like this one seem to be on the rise.
It's a difficult story to tell.
On board, I have a 29-year-old female patient who is 32 weeks pregnant.
Homeless, addicted to fentanyl, and pregnant. A woman goes into labor on the streets of Southwest Portland, right across from a fire station.
No pain at this time. We did use fentanyl about an hour ago.
That chilling call came in 2 weeks ago. KGW met the woman at her tent this week. She did not want to share her story on camera, and her baby remains in the hospital.
It's tragic. As a pediatrician,
Dr. Dimitri Duchovny is the medical director of OHSU's neonatal intensive care unit.
So I take care of babies when they're born and they have exposure to opiates.
He says they're seeing an increase in the number of babies born addicted to fentanyl.
The use of fentanyl has increased quite a bit in pregnancy just in the last few years.
Doctors are still learning how to treat a newborn withdrawing from the drug.
Some of the things that we're seeing is around the withdrawal starting out early, like it starts almost right away and in the first 12 to 24 hours of life, versus some of the other opiates. We know it's a huge problem, and it's a huge problem for that person and not getting the necessary care that they're getting during their pregnancy.
The first responders were called to help the woman who went into labor in her tent numerous times, offering treatment and housing, but she declined those services.
Our outreach team has made contact with them.
A team of Multnomah County outreach workers continue to try and help her.
I think it highlights the complexity of what we're dealing with in our community. There's tons of folks in our community that need a higher level of support, but the way our system's set up and the way that it functions right now, it's individual's choice.
Leaving them with no other option than to keep trying.
We never know if it's going to be the first attempt or the 100th attempt. And if we don't provide that 100th attempt, we're never going to find out if that person is ready to receive care.
Blair joins us now. Blair, we've received a lot of questions around this from our viewers, and one that keeps coming up: could the state have intervened in this particular case during the pregnancy, even if the mother didn't want help?
Well, Evan, the Department of Human Services tells me that Oregon law prohibits them from intervening before the baby is born, only after and if it's reported to them. And I will add, first responders are required to report such cases. Only then could they step in.
In this case, the baby is still in the hospital. Blair, do we know what will happen next there?
It's still hard to say, but doctors tell me that babies withdrawing from fentanyl, they have to stay in the hospital much longer, sometimes up to a month before they're healthy enough to leave. And again, this is a problem that is relatively new that doctors are seeing, and they're still learning how to treat such cases like this.
Of course. And what about custody for the baby in this case or in cases like it?
Well, it's still unknown in this case, but what I can tell you is that we talked with the woman's partner yesterday, so the father of the baby, and he tells us this is not the first child they've had together on Portland streets, and the first child is being cared for by the grandmother, and he assumes that will be the case here.
Got it. Thank you, Blair, for your reporting.